Thank you for joining us again for the Getting to Know Us video series. This is the last video in our series, and today we're going to be interviewing our nurse, Carol, about the nursing department here at the Brazos County Health District. So Carol, first, please tell us a little bit about your background and what led you to the Brazos County Health District.
Well, I've been a registered nurse for 23 years. Mostly been in pediatrics or in the realm of public health. Probably about 20 years ago, I came to the Brazos County Health Department with some PD experience and worked here for about 7 years, and then left and did school nursing for about 6 years. And then from there, I came back about 6 years ago to the health department. And this has always been my home. This has been my favorite job thus far as a nurse. And I love public health nursing. It's the best kept secret.
Great. Now, what does a typical day look like for you?
We do a little bit of everything, and I think that's why I like my job so much. So we may start out doing immunizations with children and adults. We may move into free rapid HIVs or do a combination of the two during the morning. And then in the afternoon, we may be doing STI clinic. I field calls for providers to help with the Vaccine for Children program and oversee that. So as they need help, we get to do that and do education to the community and to our providers. So it is ever changing, and you're changing gears all the time, and it makes your day go by fast. And everything we do, we absolutely love.
Great. Now, what's your favorite part of being a public health nurse? You covered a lot of things you like, but what's the
I don't
one
know if I
thing?
could pick one thing, but I think I really love the education part of it and the interaction with either the kids or the clients that come in. I think that's the counseling and the education to the providers. I think that's my favorite.
Very good. Now, we mentioned vaccines. So some parents have kids that they get a little panicky when it's time for their shots. What would you say to parents who have one of those kids that get really nervous, they may throw a tantrum? What would you say to them to help keep their kid calm through the process?
I think for kids, it's a normal reaction, and it's a fear. And even as parents, I think sometimes they feed on our fears, because I don't like getting shots either. So you can kind of transfer that a little bit in that fear. I think the best thing you can do is to stay calm, to keep your voice calm and low, to reassure them, not to lie, to tell them exactly how it's going to be, how it's going to feel, that it's going to be okay, and reassure them. Not to use shots as a punishment. If you do this, then you're going to get a shot, kind of thing. Mm-hmm. But really, even if you're scared of shots yourself, not to kind of project that on the child. Just say, hey, it's going to be good, and when we're all done, you're going to be proud of yourself, you're going to be a rock star, and kind of build it up, but not to lie like it's not going to hurt. You want to build that trust at the same time. And then allow us to kind of come in and build that relationship with the kid, and reassure them and talk with them about what's going to happen and that it's going to be okay.
That's a good word. Okay. Now moving on, unfortunately there's a lot of stigma in our society surrounding sexual health and getting tested for STIs. Now what would you say to someone who's nervous about coming in to get tested for STIs?
It's always amazing when we have a client come in for the first time. After they go through the process, they're like, wow, this was really great. I was so scared to come here, and I got some really great information. I feel better that I came in. So I usually in the counseling, I say, you should get a checkup every 3 months if you're sexually active. If you're in a new relationship, both of y'all come in. Start fresh. Like, let's make sure everything's good before we start this relationship, and make sure we know what our status is before this relationship continues. Same advice I would give my kids.
Very good. Okay. And so lastly, what's the one message that you want to get out to our community?
I think preventative health is a key to a happy, healthy lifestyle. And if we can get ahead of disease, if we can prevent disease through vaccines, if we can be checking ourselves for STIs, if we're sexually active and protecting ourselves, that is a key. Like, what can we do to make myself healthier every day, whether it's preventing heart disease, diabetes, STIs, vaccine preventable disease. Prevention is the key.
Definitely. Well, thank you very much for joining us. This concludes our series, Getting to Know Us.